Okay, thank you guys for all getting together. I realize we may have some light attendance based on power outages and other emergencies out there. So this is being recorded. So once it's ready and available, I'll let you know that it's available for employees to watch. So we are now at like 10 months in to COVID. And as we know, as of late, numbers are still growing. So with that, we're seeing more and more people affected, whether you personally have been affected, you have family members, or know of people who've been close contacts. It's happening more and more. So, and there have been some updates and things have changed. We've learned more as we go along and guidance has changed. So we just wanted to really do this again to provide those reminders and updates. So back in November, Cal OSHA actually passed some emergency temporary standards, which gave us more guidance that said employers should have a COVID-19 prevention plan. So you may be aware that we have a safety plan called our Injury and Illness Prevention Plan. So we will have a specific COVID prevention plan. Many of the elements that are included this are already in our site-specific plans that you may remember back in the spring that we put together before any kind of reopening, where we've identified hazards, we've identified protocols and procedures, and then there are some additional things now that I'll go over today. This applies to all employees reporting to any district work sites, even after we start to become vaccinated. So keep in mind that will change over time, but some of these procedures are with us for the near term. So the COVID prevention plan includes elements like communicating with employees on prevention procedures, identifying hazards, maintaining distances, face coverings, controls, investigating COVID cases, testing even, and making sure we exclude COVID positive individuals or close contacts out of the workplace, and providing criteria for returning to work. So the first thing I want to do is review how it spreads. Now, you may be like me, like overwhelmed with the news and it's on every day, and you may be constantly reviewing the CDC website, but you know that we've learned more about it as it's developed. It is an infectious disease that spreads through the air. When someone who is positive with COVID talks, I mean, we know about the things like somebody sneezes on us or coughs on us, those are the obvious, but when somebody talks or exhales or, you know, that kind of thing. And it also may be transmitted when you touch a contaminated surface and then touch your eyes or nose or mouth. So that is why physical distancing is so important and face coverings are so important. I want to emphasize this point. Face masks are not a replacement for 6 feet. We must maintain 6 feet at all times, whenever possible. You know, obviously, except for I'm passing someone in the hall, we're going, you know, that kind of thing. Those intermittent interactions, you know, that happens. Um, Hazards. So we know in this pandemic, the biggest hazard is people and people being together. So therefore we have gathering restrictions. No one feels this more than our recreation staff. We have limited programs right now, and our employees. So that's why we ask our employees to self-screen every day. Or work site procedures like teleworking, staggering shifts so that everybody's not coming in at the same time, placing markers in areas to remind people to maintain distance, or barriers, whether it's a table in front of the front desk like here at Hillcrest Center so someone's not standing at, you know, within 6 feet, or whether it's a plexiglass, limiting the number of people. So some people might be teleworking, some people might be in the office. Limiting people in rooms, like our break room here is pretty small. We now have a sign that says 1 person at a time. Staggering lunch periods, like eating outside, and at all times 6 feet. That's really a thing I really want to emphasize. And then, as I said, self-screening. So we rely on our employees to self-screen before they come to work. That is, am I feeling well? If I'm, you know, take your temperature if possible. Stay home if you're sick, or if you have any of the COVID related symptoms, and we'll talk about what all that means. Those symptoms include a lot of things, I know. And on the CDC website, there's a list. There's even a self-checker that you can go through and say, I have these things. But the symptoms can include everything from fever or chills, cough, shortness of breath. Those are the top ones. Muscle pain, sore throat, runny nose or congestion, nausea or vomiting, even diarrhea, or new loss of taste or smell. If you're experiencing any of those things, please stay home. We don't know if it is or not. I know you don't know if it is or not unless you know that you've had a specific exposure, but those are the potential symptoms, and it may turn out not to be, but we would rely upon a medical provider to make that determination. Face coverings. So face coverings have changed a little bit over time. You may recall, I think it was maybe back in, I don't remember the exact, maybe June, face coverings were changed so that indoors we must wear them at all times, except for instance, if I'm in a room by myself. In a room by myself might be my office. But if you're in a common area where somebody may walk through, there's 5 people in the building and somebody may walk past your area to go to the copy room or to the restroom, you should be wearing your face mask. Outdoors, whenever you're with, engaging with the public, or if it's possible, somebody may walk by you. Again, we always want to maintain distance, but the face masks are important. It's important that they be worn properly. That is covering your nose and mouth, washing them daily, and face coverings should now be available at all work sites. So if somebody forgets, they dropped out of their car and blew away today, there should be one available in the center or at the work site. Physical distancing, again, I just want to, anything that can be done to mitigate, such as even opening doors and windows, even if you're in a room, but for instance, in our community room, that, physical distancing may be taking place, but the door is open to bring in as much fresh air as possible. And then the usual things that we hear about all the time, washing our hands often with soap and water for at least 20 seconds, or using hand sanitizer when you can't wash your hands with soap and water. Avoid touching our faces, sneezing into your elbow or covering. I think for the near term, handshaking is no longer. So we'll discontinue with that process. And then cleaning and disinfecting. And again, this is a reminder. Besides the normal day-to-day cleaning, clean your workspace. If you go to a copy room or the break room where other people are using that equipment, use the available cleaners and disinfectants to clean the area. Allow enough time for cleaning every day. Now I'll talk about what happens when somebody is individually affected. So there's 2 concepts you've probably heard a lot about, and that is quarantine and isolation. Quarantine keeps someone who has been in close contact with someone who is COVID positive away from others. So you may have had close contact, so you should stay home and watch for symptoms because it may take time for it to develop. So that's called quarantine. Isolation is for someone who is sick with or is positive with COVID-19 and must stay away from people until they're able to meet the criteria to return to work or be around others. If someone is sick or they think they have COVID, stay home until after, and here are the current criteria for returning to work. 10 days from when symptoms first appeared, if somebody is symptomatic, and 24 hours with no fever, without fever reducing medications, and any related symptoms have significantly improved in the last 24 hours. And of course, they've complied with all their provider directions. People have, individual healthcare situations that their provider may have given them other guidance, and of course, they should follow their provider's guidance. So this includes anybody who is sick, but they don't know if it's COVID or not. So if we have somebody who's sick and they call out, please let me know, we do provide employee with instructions. So if an employee calls out sick, they should contact their provider for guidance. Again, we don't know, we're not doctors, we don't know if it's COVID or not. They should stay away from the workplace, and check with their provider. They can return to work either with a self-certification form where they're certifying to all of these things, criteria to return to work, or a doctor's note. So the provider is the best person to determine that it is or it is not COVID related. Now, they say that up to 50% of people that are COVID positive don't even have symptoms. So if someone tests and they come up positive and they are not symptomatic, they must stay home until 10 days after that test. The test date is the date that the test was actually taken, not the day that they received the results. Results can be received within 24 hours or up to several days later, depending on what's going on with testing. Close contacts. This is another thing that has evolved over time. So close contact is anybody within 6 feet of an infected person for a cumulative total of 15 minutes and in a 24-hour period. So think about a work day. So that's closer than 6 feet. It could be 3 5-minute periods, 5 3-minute periods, 15 1-minute periods. And so when an individual is positive and I'm asking them if there was anybody that was in close contact, we try to describe all of these situations so that they can think if there was anybody that was in close contact with them. Again, a mask is not a substitute for the 6 feet. So if I say, were you in close contact with somebody? And you say, well, yes, but we were wearing our masks. Again, the mask is not a replacement for the 6 feet. A close contact is someone that we identify as, when we learn about a positive, we look at the 2 days before symptoms began or 2 days before their positive test if they're asymptomatic. So I'm going to look back at that period and say, during those 2 days, if they were at work, identify any close contacts. If somebody was identified as a close contact, we would direct that person to stay home and quarantine. Sometimes by the time we learn of a positive, it may be 5 days, a week later. So sometimes someone goes out because they're sick, but they don't know that it's COVID yet. And later, once they test positive, then we go back and there's a timeline that we develop. So how do we identify close contacts? We work with the individual who has tested positive to help identify anybody that they believe they've been in close contact with. We are now part of the new requirement is anybody who is identified as a close contact of another employee, we will inform them to go get tested. I'll provide them with the list of places they can go get tested. They can get tested during work hours and at no cost to them. So I refer them to the website that gives the local sites that are available for them to get tested. Employee obligations, obviously to stay home if you're sick or have any potentially COVID-related symptoms and notify your supervisor. Notify your supervisor or HR if you have tested positive or if you've been identified as a close contact from another source. So maybe we've not identified you as a close contact, but more and more people are getting notified by outside sources, family or friends or some other contact that has tested positive. So if you have been notified, then you need to quarantine and stay away from work and notify us. Again, I have instructions that I send to the employee that tells them about being able to return to work, when they can return to work, what they need to do, and also available pay. So what we will do when this happens. So one of the things that we are doing is we have to gather information from the employee. So I have to determine what was their last day at work. What was the date that they tested? Again, not the date they received results, because it could be several days later. What date did symptoms begin? Who are their close contacts? In addition, all the work sites that they visited in the last 14 days. That's kept as for reporting purposes for tracking. I'll let them know about available leaves. And then I also ask that employees stay in contact with any changes. Again, someone goes out or is out sick and later determines that, they later test. They didn't initially test, but later test. Anything changes in their situation to notify us. We also work closely with supervisors to identify other employees who are at the work site. So that's part of the notification process now. So many employees have already received this kind of notification. So when we learn of a positive case, we will notify any employee who is in that exposed workplace, that is within 2 days of either symptoms or the test, of a potential exposure, and you will get notification within 1 business day. So I will send an email out. It's more of a FYI. There's been a positive case at your work site. You were at work on the same day this individual was. We don't, no personal identifying information. It's a reminder to follow all the protocols, keep 6 feet, follow all the preventative measures, and monitor yourself. Again, monitor for symptoms or any changes and let us know of any changes. If somebody were identified as a close contact, I would give them specific instructions to direct them to remain off work, to quarantine. And then as we've actually experienced, recreation may make decisions, for instance, to close a program down for 2 weeks, depending on the circumstances. You may have heard a lot in the news recently about outbreaks and testing. So there are requirements for outbreaks, and an outbreak is defined as 3 lab confirmed positive tests in a 14-day period at a work site. So if we have, this is why we track each positive case. And if we have, once we have the 3rd case positive test in a 14-day period, we have additional obligations and requirements, one of which is to notify public health, one of which is to offer testing to all the employees at that work site and inform them how they can get tested, and then provide weekly testing until there are no longer 3 cases in a 14-day period. So that's why it's also very important to monitor those cases and know about when somebody's out and know about when somebody tests positive. Just a few additional reminders of questions that I get is, what if someone in my house is sick? Again, and what if someone in my house has been identified as a close contact? So assuming you have been in close contact, you may want to consider testing. If you've been identified as a close contact of a family member who's tested positive, you should quarantine. If someone in your household has been identified as a close contact, then at that moment, you're secondary. There's not a requirement at that moment that you quarantine. But if anything changes, like that person then later tests positive, you would be considered a close contact. Let's see. And then the other thing about testing and returning to work. So our criteria to return to work, again, is either the employee completing the self-certification form where they certify that it's been 10 days since their test if they never developed symptoms, or 10 days since their symptoms began, and they have no fever without fever reducing medications in 24 hours, all other symptoms have improved, etc. Or they provide a doctor's note that says you can return to work. So the question, I've gotten a question, well, if I just go get a test and I'm negative, can I return to work? Well, if you're subject to quarantine, then no, you must remain out for the period of the quarantine. Again, because it can take time for a positive result to occur. I've heard of people who go get tested quickly, like within the first few days after they've had contact with a positive, and it's negative, but it could be positive a few days later. So that's why we ask that you remain out during that whole quarantine period. And then the leaves that are available. So of course, I'll let an employee know that, what leaves are available for them to use during their quarantine or isolation period. Um, uh, the FFCRA leaves, the emergency paid sick leaves, did expire on 12/31. However, there are some provisions for voluntarily continuing. So we are currently voluntarily continuing the emergency paid sick leave. So if under the same criteria, so if someone has a need to be off for quarantine or isolation, if they have not already used it, it will be available in addition to their accrued leaves. And there are certain circumstances which are identified in the emergency temporary standards, which provide for the employee to be paid not from their leaves. So we will evaluate each situation as it applies, and if those are applicable, then they would receive continued pay while they were out. I think that's all I have for the COVID stuff. So I have two more quick reminders and other things that I'll just mention. One is about signs. I know that especially today, I think if you walk out the front door, signs are blowing off everywhere, and I know people are taking them down. So just as a reminder to, at all your work sites, make sure that the signs are up and replace them if needed. That still continues. For instance, our building here is still closed to the public, but we have all the signs on the front because we may have a delivery. This COVID prevention plan will be sent to each site once finalized to be added to your binder. So we'll just add it as an attachment to your site-specific COVID prevention plan. Vaccines you may have questions about. I don't have a lot of information about that now. Jim might talk about that a little bit more. All I can say is coming soon. Monitor the VC Recovers website as they move through the phases and identify more people and how people will obtain those. And my two other notes that I want to mention is it was in, I think, one of Jim's weekly updates, but the California Public Health does have a travel advisory for the state of California. It was updated on January 6th. So I just want to mention it because I do occasionally get questions. It is an advisory, but it suggests that non-essential travel more than 120 miles away from one's home is discouraged, and people returning from California from other states should self-quarantine for 10 days. So I just wanted to mention that that's a state travel advisory. And one other non-COVID but upcoming legal note is that you may have seen it in articles about new laws in 2021, beginning July 1st for driving safety. Drivers who get a ticket for being on their handheld cell phone, it will be a point on their driving record. So I think up to this point, it's a fee of $20 or $50, but keep in mind, beginning July 1, it will be a point and it will stay on your driving record for 36 months. So that's just an FYI. And then my last note is about the personnel policy. So it has been under revision, under construction, and it will be coming soon. We've met with the employee group and union today on the revisions, and we are looking to bring it to the board for approval on the February 4th. And it includes clarified language over the years that's been questioned. Legal updates like changes in the harassment policy that have occurred over the last several years, family leave updates, like California Family Rights Act, or California FMLA, if you will, changed beginning this year to include additional family members that were not included before, like grandparents and grandchildren that are not covered under the FMLA, Federal Medical Family Leave Act. And then also includes previously negotiated items from the MOU that are moving into the personnel policy, like our vacation accruals changed a few years ago. And so it's updating the personnel policy to reflect those changes. And with that, I will turn it over to Jim or open it up to questions, however you want to.
Well, actually, let me talk about vaccines, and then we'll open it up to questions about COVID, and then I'm going to move on to non-COVID stuff, and we'll start over with Q&A after that. So I did send out something about vaccines in a Friday message. In short, I don't think anybody in the district, like, you know, a ranger or somebody arguably in childcare, would probably be the earliest in our sort of working world that could get the vaccine. And they're still at least until sometime in February before they're going to get to that tier. I just heard a rumor, and I'm going to spread a rumor even though it could totally not pan out, but the frustration with all this occupational restrictions at the state level, like it's kind of such a cluster with, you know, who's working in what industry, how do you prove it? You know, they build this website for people to sign up, but there's no way to like verify that they're actually working in one of those industries that is qualifies. So then if they can verify they're not part of it, then does a shot go unused? So I'm kind of hearing that there's a possibility they may scrap all of the occupational sort of limitations and move to purely age-based and just, you know, get your ID, what's your age, do you qualify to get the shot, yes or no? But we'll see. For now, I'm sure we're gonna definitely keep doing the medical field people and probably, I think, the 75 and olders. I'm gonna, if I try to share screen, I'm trying to see if, is that, let's see. Are you guys actually seeing, give me a thumbs up, Rochelle, if you can see my Ventura Recovers website.
Yeah, I can see it.
Okay, good. So this is the Ventura Recovers website. So I hope you all go to this. I do the link every week. I'm hoping you guys go take a look at it. I'm going to show you over here, register for coronavirus updates, register for vaccine updates, go to their website and just register, and then you'll be in the know as soon as the information changes. So if you're wondering where all these tiers are and who's in what tier, that's just clicking on one of these things on the website. So here's the full list of the vaccine phases and the groups. So you can see like phase 1A, tier 1, and it's pretty much all medical personnel. Tier 2 in phase 1A continues to primarily be medical personnel. Phase 3, it gets outside the medical world and gets into pharmacies, physical therapists, sort of that kind of stuff. And then it's not until phase 1B, tier 1, when you start to get into arguably law enforcement. You know, I've got a request in that our rangers be considered in law enforcement, and that this education sector, childcare, that anybody in CRPD that works in that world is eligible in that phase 1B, tier 1. But I am not in those meetings. What's happening is the city managers, there's 10 cities in Ventura County, the city managers and county health get a chance to, they get a chance to talk about once a week. And it's, I've mentioned to the city that we wanted them to kind of advocate for us. And every city's got the same thing, you know, or, you know, they have rangers, they have people working in sort of a childcare capacity. So we're trying to get the vaccine available to us, but it's going to happen when it's happening. I'm personally in that, you know, I'm young enough that I'm not in a sensitive category. Thankfully, I don't have an underlying medical condition. So I figure I'm not going until June or July. So I'm not getting myself all excited about it. So that's where we are with vaccines. So do you guys have any questions about COVID, what's going on with the district, you know, anything? And I don't know if, Rochelle, are you going to be the eagle eye?
I can. I'm not seeing a chat section, so they can't put it in their chat. So you're going to have to raise your hand, like physically raise your hand so that we can see you. Unless Gabby does it a different way.
I see D.
Okay, so D, unmute.
Hi, everybody. I just had a quick for Shelley. You said the household, if somebody gets it, you quarantine, and if the household comes home from their place of work or whatever and says, I've come in contact, then there's no requirement. Is that correct?
So the specific evaluation is whether someone was in close contact with a lab confirmed case. So if I go home and my husband tested positive, if I was in close contact with him, that is within 6 feet for 15 minutes or more in a 24-hour period, then I have been in close contact and I should quarantine. If he comes home and says that he has been a close contact of someone who outside of the household was positive, then he is quarantining, but I'm secondary. I have not been in close contact with a lab confirmed case. So it's kind of an individual evaluation based on a timeline and the exposure, potential exposure to someone who is positive. Does that make sense?
Yeah, thanks.
I saw Kurt's hand up also. Kurt, you want to unmute?
Yeah, so the travel advisory in regards to traveling out of state and then having to quarantine when somebody comes back, it's an advisory. So is that something that Crpd is holding fast to, that if somebody travels out of state, they therefore have to quarantine when they come back and can't return to work?
So we are treating it just as the governor has the public health has issued it. That is, it is advisory. So we are not requiring anything different. We are not directing people. It is advisory, if that makes sense.
Okay, so if somebody travels out of state, we are not requiring them to not come into work.
Correct. Unless they've been a close any of the other things, if they've been in close contact with somebody or any, yeah.
All right, anybody else raising hands? I don't see pictures on a lot of people, so I can't tell if you're raising a hand or not. Okay, I don't see any other hands being raised and I don't see anything in the chat.
Okay, so if we're done with COVID Q&A, we'll kind of get on to the district without COVID, or at least the district as it goes through this sort of the end of COVID. I'm going to do a quick screen share again, if I can. So we basically have our 5-year strategic plan, and that's the document. If you were to want to look at one single document that best captures kind of everything the entire district is looking at and working on as a sort of general direction, I would look at this 5-year strategic plan, and I hope each one of you on this call has looked at it and checked it out, once in a while. I try to make myself read it virtually cover to cover every quarter, just so I just kind of remember every little nook and cranny of it, because you can get lost in the day-to-day and forget about the big picture stuff. But big picture direction, we did the update last, I don't know, January, February, and then COVID hit. So sort of we ended up this last year in suspended animation, and just we kept moving the ball forward. Parks and stayed open, and rec did their thing, but some of the quote new things, the strategic elements that we wanted to kind of work toward, we kind of put on hold. The biggest, most important one was the idea of doing a revenue measure and asking the voters if they'd be willing to pay more money for rec and park. That's a huge ask, once in a generational kind of a thing. We feel like we're poised to try to make that ask of the voters. We're operating with the assumption that by June that COVID is under control. We may not be completely back to normal. We may still have sort of size limitations on gatherings and that kind of thing. But at least I think we can start to imagine life without sort of the day-to-day COVID stuff that we're living with. So our thought, and the board has supported this direction and we're going to go forward, is that we're going to go ahead and do a revenue measure, or at least do the public opinion survey this spring. So what that means, and this is all kind of captured here in the finance thing on this revenue sources. we're going to go ahead, do the public opinion survey, try to ask the public whether they might be willing to support additional investment in Rec and Park. It's, you know, for a whole variety of things. The biggest sort of gorilla in the room is the cost to replace an entire community center, a Conejo Community Center, to replace it the way we kind of imagine it being, and kind of all the other improvements around the park. Tom will probably want to kill me, but, you know, I'm going to throw out a number just so that people aren't totally shocked, but that alone is probably an easily $15 million project. And we sort of average $3-4 million every year with all of the other capital we do. So to take on a project of that size, we will never, ever replace the community center without new money. We have to have new money. We can't do it with the kind of revenue sources that we now have. So, you know, we're at that point. We think we've reached the point that if the community wants to see the park district get to the next level, we're going to have some additional revenue. So I'm sharing that with you guys, and I'm going to stop screen sharing. I'm sharing that with you guys because we have to kind of build a case over the next year to two. We don't know if we'll go out. We don't know when we'll go out. We're sort of thinking it could happen in 2022. But the consultant world and people that work in this kind of field, it is no small task to get something like a revenue measure to pass. Like, you know, people don't want to pay more. They don't want to, you know, vote more taxes on themselves. And to make things tougher for us is pretty much anything we do is going to require a 2/3 vote. So we got to get 66% of the population here to want to pay more money. So it's no small ask. But we think we're up for it. We're kind of excited about the idea to make the case. So this year we're going to be doing a lot more educating and informing than we may have in the past. So the marketing, the communications, the social media, the video stories about the district, trivia, frequently asked questions, the fact that we're a separate independent special district and we're not a piece of the city, we're not a part of the county, we're going to try to elevate the education of this entire community about what we are and what we're doing, because we think an educated community is more likely to support us. So we're going to be doing that. So probably each and every one of you on this call will probably star in some little video segment at some point during the year. We're putting together, we're putting together a kind of a big story arc of what we want to cover and kind of when we want to cover it. And we're going to try to put that together. Just so you know, we are obviously without Kathy. She retired. So Rochelle's got to try to figure out who that replacement person will be. We have hired an outside consulting firm, Mustang Marketing. They're local in town. I don't know if anyone knows Diane McKay but Mustang Market. Diane is an elected member of the community college district. She is very involved, was part of the team that got Measure I to pass for the school board. So she's pretty up on doing these kind of revenue measures. So we've got them involved. And so don't be surprised if we come and tap you on the shoulder and say, hey, we'd love you to talk a little bit about your part of the district, what you do and how you do it and that kind of thing. So that's kind of a big, probably the single biggest thing. I'm going to let Rochelle and Tom and Melissa each kind of cover a little slice of maybe what they're working on. And Melissa, Rochelle, I know Tom has, you know, A, B, C, D, E on the capital projects to go through. If you guys don't have something in particular, I apologize for giving you last notice. Make something creative up. You're smart. So go ahead. We'll start with Tom.
Thanks, Jim. Yes, I'll give Melissa and Rochelle some time to think of something to say. So just going over some capital things that are going to be going on in the next 6 months to a year. Parks are still going on. Like we said, during COVID, parks are open. The maintenance crews are out there still doing their thing. But some of the bigger things that we got going on is this Thursday, the board's considering doing an internal loan from the general fund to the PDF so we can get Conejo Creek Southwest built. That's a very large neighborhood park, 14.1 acres. It will definitely help out with the acre deficiency that we have in that area. It's bisected by Page Lane. The east side of the property up against the 23 is the flag or the more active area with playground, volleyball and basketball courts. And then the west side of Page Lane is more of the passive area. It'll have walking paths and some open turf areas. Also in next month, we anticipate the City of Thousand Oaks Council and our board considering a grant agreement to continue on with the expansion and renovation of the teen center and the renovation of the Global Adult Community Center. That's a $2.7 million project. So hopefully that will take place next month. And then we hopefully would be going out to bid and then maybe starting construction in the summertime. Currently, we have 3 playground projects going on. We have over at Pepper Tree, we have the playground renovation plus the fitness course renovation. And then we're also doing some good things over at Glenwood and also at Wildwood Neighborhood Park. And that should be, we anticipate maybe in about February for completion for all 3 of those projects. Another one that we're also, a lot of anticipation here that we hope with the City of Thousand Oaks, we might be taking over the operations of the Rancho Potrero Equestrian Center. Dos Pinos community has already been involved with working with Ride On, who's been doing the operations for about 18 months out there. So we've actually have done some programming partnerships with Ride On there. Part of the takeover the operations would possibly include getting some additional funds from the City of Thousand Oaks to do a multi-year capital projects. Lots of things that need to happen out there. But that'll probably be over like a 3 to 5 year period to get that place up to speed. And then in March, April timeframe, we're looking at to get 2 other projects that should be awarded. Over at the main dog park, we're installing 2 shade structures, one on the small side and one on the large side, paving the parking lot and adding a permanent restroom out there. And then also we have another project for district-wide drainage improvements that could be anything from just repairing a current system that needs a little bit of help, or putting in a whole new systems to help out with the drainage and vegetation removal. Year-round things are still or not year-round, but things that are kind of like challenges that we have going on that are always in the back of our mind. Jim did allude to our Kineo Community Park, where we do have a consultant on board that is in the design development process. So at some point, we're going to get to the construction documents phase, and then we'll be ready to go out to bid. But as I said, Jim mentioned, we'll probably need about $15+ million to actually get that project under construction. But we're really excited with what we've come up with between the community and the recreation staff and park staff. It's going to be a fantastic building, and hopefully someday we can, in the next year and a half or so, we can actually break ground on that project. And then, kind of tying back into Canal Creek Southwest, one of the issues that we're going to be having with parks is the City of Thousand Oaks is unveiling their general plan, or they're working on their general plan, and they're looking at their density maps that they have, that they're looking to add additional housing units throughout the city, and also I'll say throughout the district then. And then we would need to take a look at where these additional housing units are going to be, because we have a standard of 10 acres per 1,000 residents. And if, depending on where these housing units are, we're going to add new acreage, or we're going to want to add new acreage somewhere in the district to accommodate those new houses that are out there. And again, tying back to Canal Creek Southwest, Canal Creek Southwest is the planning area there, serves as Thousand Oaks Boulevard, and having those additional acreages available for the folks on Thousand Oaks Boulevard will greatly enhance their experience and life in the Thousand Oaks. So that's all I have. So I'll turn it over to Rochelle if she's ready. Or Melissa.
I figured it out. For some reason, it wouldn't unmute. So for recreation, basically we're just continuing to change as life changes. And my hope is that as this year progresses, that we're going to continue to be able to open more things and see more gatherings. And as that happens, I think one of the things that the direction that I've kind of heard from Jim and stuff is that we want to make sure that CRPD is seen as being the go-to person in the community to welcome everybody back. So making sure that people feel comfortable with the safety precautions that we're taking, and getting people to get back into the groove of being around each other and stuff. So I look forward to, hopefully, as the months go on, be able to continue to open things and get things back to like 2019 time or something like that. The other big thing that we'll be doing is, and I'm sure Melissa will talk about this, will be budget that's coming up. And it's going to look really different this year because last year was not great. So looking at how we plan for that and what it looks like and how we budget for that moving forward, all while we continue to serve the community and meet their needs, whatever those needs are. So I think that's the gist for me. Melissa?
Okay. The first thing I have 3 whole things. The first one I have is just, I wanted to give a shout out to Shelly and the HR challenges that have come with COVID. She's done an incredible job making sure that we all know and trying to keep on top of all of that. And it's extremely complicated. So she's done a great job, and she's always a resource for staff, and that includes me. So thank you, Shelly. The second thing that's going on, Mark has been working hard on a paperless time tracking ability for the agency, and had an IT committee meeting this morning to talk about options and get some more details on the scope. But we're likely going to be able to do at least some testing on some time tracking options coming up soon, probably starting with full-time staff and then rolling it out in phases so that we don't have a big problem. So we'll probably phase that out, but it's looking really good. And thank you to the IT committee for working with Mark on that and your suggestions. And then the last thing, as Rochelle mentioned, is it's the 2-year budget is coming up. And in addition to COVID making everything weird, it's my first time going through a 2-year budget. So I will do my best, and please be nice. And that's all I have.
Well, thanks both, all 3 of you. Thank you very much for that update. As just sort of a Tom hinted on it, I was going to just kind of wrap with what's going on with our neighbors. The city is going to be very, very invested this year in their land use maps and development projects trying to move forward. So this will be one of those years where land use and development will be probably more capturing the attention of our public than sort of it has in recent past. And it's been ugly in years before, but there's just so many. It's a hard thing for the city. The state of California is requiring cities to have more housing because of the homelessness issue, because of the housing affordability issues. And so the state is requiring that, but we know the public here often wants to resist new housing. So they're going to be struggling with that. The school district, I know they have, all 5 of the board members have been elected in the past 2 years. So they have a pretty green leadership board. And Mark McLaughlin, Victor, the other folks, Lou Lichdahl, the staff there are now the persons most tenured and knowledgeable about what's going on there. So the school districts, for those of you working closely with them, they're kind of in a new phase in their trajectory. It's hard to know where they're really going, but I know Rochelle was talking to me. One of the things they're considering because of all their financial challenges is dropping childcare. So if they do that, then there's going to be this scramble. What do we do with all these kids? And are they going to go to the Y? Are they going to go to the Boys and Girls Clubs? Are we going to have way more involvement with after school, that kind of thing? So that's going to kind of unfold in the next coming months as well. One last just kind of weird thing, just sort of topical. I saw, because the TOPD released a little press release on it, there have been those folks who call themselves First Amendment auditors. And you guys, I think we've talked about it, but these are the guys that kind of put a camera in your face and do really uncomfortable, odd things, kind of goad you into conflict. So they'll go into a place where the public is allowed on public property and where the public is allowed to film, but they'll try to get staff to react, to do something that they're not supposed to do, or try to limit their free speech rights or whatever. So that's been kind of happening not only in government facilities, but also private sector. And what I found out is basically there's literally like YouTube channels devoted to these guys and putting their little shows together of getting public sector employees all flustered and saying the wrong thing or doing the wrong thing. And then, you know, they make matters worse. If somebody does something really wrong, they sue the agency. So despite all the weird stuff happening at the federal level and the partisan politics and that tension, you also now have these folks that are trying to monetize conflict with government employees. So I would just say, just be guarded and be on the lookout for somebody who's doing something odd, especially if they're filming it, right? And trying to goad you into conflict. So, you know, best thing to do in those weird situations is just walk away and either call the cops if you're at all feel threatened, or just call a supervisor or manager or staff. Just remove yourself from the situation. So that's just kind of a little warning, because I guess that's been happening at some places in the county. So with that, I think we all stand available for questions. It's a little before 1, I think, or 2. It's a little early, but anyone, general questions? I'm looking, not too many faces, a lot of just names. Wow, all right. Well, with that, let me just close by then saying thank you so much for all of you that I know are living, all of us living in interesting times. None of us imagined this a year ago, and we've kind of lived through this really, what will obviously be one of these historical times. I am grateful to each and every one of you. The Park District, I believe, is doing better than most when it comes to actually continuing to deliver our services and also keep safe, which I'm most concerned about is all of you guys staying healthy. To those that have had it, I think Shelley could correct, but I think we're at 11 or 12 that have tested positive since March in the district. Might be a little higher. What are we at? Just, which is collectively total since March.
I want to say 14 employees. Yeah, 14,
so,
15. Yeah.
Okay, so to those 14 that did, you know, contract it, I don't have any medical info, like, you know, Shelley's really good about HIPAA. I often don't even know who it is, so she keeps me from knowing. But I have not heard of anybody get a serious, you know, long haul, multiple days in the hospital kind of thing. So far, and I'm very grateful for whatever reason we've managed to not have anybody really, you know, end up in a hospital situation. And I really want to avoid that at all costs. So any extra precautions you guys can take as the vaccine gets really close. Like, I just don't want to be somebody who was so close to the vaccine and kind of made a mistake and ended up with it when you didn't need to get it. So I don't like wearing a mask, but you know, it's one of those things we need to do. So thank you guys. And with that, I will wish you a happy windy Wednesday. Tuesday, it's only Tuesday. Happy Tuesday.
Do
Bye,
we
guys.
still have a supervisors meeting at 2?
Yeah.
Okay, so if we'll maybe take a couple minutes to use the restroom, get a drink of water, and be back here at 2.
Yes.
Yep. Channel?
It's a separate link. So yeah, click on the
Separate
link for
link?
2 o'clock.
Okay.
Thank you. Bye.
Bye, guys.
Bye.